Welcome, and thank you for being with us tonight. Before I introduce my guest, I would like to introduce myself for those of you who are new to CMHRC. My name is Elizabeth Errico, and I'm the Executive Director of the Children's Mental Health Resource Center. For those of you who aren't familiar with our work, we are a nonprofit charity organization who provides guidance and resources for the early identification and management of mood disorders, bipolar disorder, and its newly identified phenotype dubbed fear of harm, or FOH for short. These disorders are extremely isolating for children and families to live with, and they are complex for providers to treat. So we at CMHRC are here to break down that isolation and to provide the support that everyone needs to ensure our children get an accurate diagnosis and a treatment plan that works. To fulfill this mission, we provide a multitude of services for families as well as for mental health providers and for educators. We have a diagnostic consultation service that works with families as well as providers to ensure an accurate diagnosis. A school advocacy program where we provide mental health information to schools in order to ensure that children have the accommodations and supports they need to be successful at school. We also have access to the CMHRC Toolkit, which I have to say is something we're very proud of. It is a web app that tracks symptoms, intensity, severity, frequency, diagnoses, medication history, as well as compliance. It even tracks the local weather. All of these services are available to both families and providers, and we have a special membership program for each. And you can learn about our programs and services on our website, which is cmhrc.org. And if you are interested in any of them, you can make an appointment for a free consultation directly from our website on any of the pages that outline our services. Before we get started, I do want to mention that we are a nonprofit and we are able to provide all of these many services and programs to families and providers only because of the generosity of our community of donors. And from the $10 that was donated by a grateful 12-year-old and his 9-year-old sister to major gifts from individuals and institutional donors, each and every gift matters to us and supports our essential work with children, families, mental health providers, and educators. Throughout October and November, we are running a fundraiser, which we call our Giving Thanks campaign. So if you appreciate the programs and services that we offer, like this free seminar tonight, we invite you to join CMHRC in celebrating gratitude and in giving hope. And we extend a heartfelt thank you to all of our generous donors for making our mission a reality. Now, tonight as our conversation unfolds, please feel free to put your questions into the chat or into the Q&A. I will be monitoring both of those and integrating your questions into the conversation as we go. So tonight I am very excited to introduce to you our very special guest, Dr. Bret Scher. He's a cardiologist, lipidologist, and the director of Metabolic Mind, where he is a leading expert on the therapeutic uses of metabolic therapies, including the ketogenic diet. Dr. Scher, welcome. Last week, we had a really inspiring and empowering webinar with Jan and Matt Batsuki as they sort of shared with us their family's experience with ketogenic therapy in terms of treating Matt's bipolar disorder. And so now we're eager to get into the science and the safety behind this therapeutic approach. So welcome, and can we start with a little bit of information on what metabolic therapies are?
Yeah, well, great. Thank you for the introduction and thank you for having me today. You know, metabolic therapies, the broad stroke is anything that's going to help your metabolism, your metabolic health. And our metabolic health is basically how we take inputs, calories, external energy, and how efficiently we are able to convert that to usable energy or store it for energy for use later. So metabolic therapies are anything that help us do that better. I mean, unfortunately, in America and in the industrialized world, we've seen studies and heard things, that 12% are actually metabolically healthy, or now a new one says 7% of us are actually metabolically healthy. And over 50% of us are going to have prediabetes or type 2 diabetes. I mean, the numbers are sort of staggering. And that's what prediabetes and type 2 diabetes are. It's a dysfunction of our ability to take in nutrients and transform it to usable energy or to store it. And what we know now, though, is that it's not this silo of this is what happens in our body, because the brain and the body are definitely intimately connected. And when you have metabolic dysfunction, insulin resistant in the body, you're going to have it in the brain. And that can manifest in a number of different ways, because what it comes down to is the brain not being able to use energy well. And when that happens, you're going to get symptoms of, it could be anxiety or depression or bipolar disorder or schizophrenia or dementia, or seizures, right? It can manifest in a lot of different ways, but at its core, it's likely an inefficient production of energy and the downstream effects of that. So metabolic therapies are things that improve that. Now, ketogenic diets are one thing that we really focus on. And it's a pillar of metabolic therapy for sure. But so is sleep, so is exercise, so is stress management, so is avoiding, certain toxins. And so it's a cumulative approach. But it seems like the biggest input, the biggest rock, so to speak, is likely being in ketosis, because that changes the chemistry of your brain, that changes the fuel that your brain is using. So if the problem is not being able to create enough energy from glucose, let's give it ketones, and let's let it use ketones for fuel in a way that over time improves that metabolic dysfunction in the body and the brain. So a little bit of a long-winded answer, but that's how I see metabolic therapies, especially how it relates to our talk today.
Yeah, no, thorough and specific, which is exactly what our community is looking for. So thank you for that answer. I heard you use the word energy a lot. We've been reading about bipolar disorder as potentially being a disorder of energy. Can you speak to that and sort of give us a little bit more background on what that means scientifically?
Yeah, it's so interesting. If you just look at the symptoms of bipolar, right? You've got mania on one end and then just severe depression on the other end. You couldn't be more different in terms of the energy that someone has and is putting out, endless energy in mania and almost zero energy in severe depression. Well, it turns out the science is evolving. So I don't want to say anything is definitive, but there are definitely a number of signals indicating that this has to do with how our body is producing energy, how our brain is producing energy. And there is this sort of disparate ability of our brain to do it. Now, by providing alternative fuel sources, we can smooth that out. Because with glucose, you get the highs and the lows. You get the rises and the crashes. With ketones, you kind of don't. Ketones smooth things out. So a lot of it has to do with just the symptoms of bipolar disorder are so energy specific. But then from a down to the sort of cellular level, it seems like we're starting to be able to tell that there's this variation in energy output with a likely significant contribution from metabolic dysfunction, insulin resistance, inability to properly and efficiently create energy from glucose.
So it sounds as though you're saying the sort of ups and downs of glucose in the bloodstream can be connected to the mood fluctuations that someone with a mood disorder experiences.
It's interesting the way you say that, ups and downs of glucose in the bloodstream. So yes, certainly, if you have a crash in glucose, you're going to feel that and you're going to feel terrible. But here's the thing that's so interesting. You could have a relatively stable level of glucose. The key is, how are your cells using that glucose? Are your cells able to access that? Because in our bloodstream, where we measure our glucose level, that's not where we make energy. We make energy in the cells. And so the cells have to be able to access that glucose and bring it in. And that's where you need this sensitivity to insulin to be able to do it. And with metabolic dysfunctions, that's what the main sort of fault is in our physiology.
I saw a story on the Metabolic Mind website where a young woman talked about sort of reframing her perspective on her bipolar disorder into thinking of it as a metabolic disorder.
Yeah.
Is that where the science is leading us?
Yeah, I think it is. So you're referring to Hannah Warren, and I have to put a little plug in. We just published just today, just a couple hours ago. We published on our YouTube channel an interview with me and Hannah, and it is wonderful. I highly recommend everybody listen to Hannah and her story. She just relates her symptoms and her journey so well. I think it's going to connect with a lot of people. But yes, I think that is where sort of the science is leading, and it's really directing us towards this metabolic dysfunction. And I really like her message that if you label me as bipolar, especially like treatment resistant bipolar, like, is that who I am? Is that what I'm stuck with forever? Or if you call it a metabolic neurologic dysfunction, that shows me I can treat that. There are treatments for this. And, focusing on metabolic therapy is likely going to help. Now, as we know, there's no one treatment for everything for everybody. There's going to be different genetic variotypes. There are going to be different phenotypes. But it certainly seems like the majority of people, if they can improve their metabolic dysfunction in their body and their brain, if they can give their body alternative fuel source, you can reverse this metabolic dysfunction, which will have some impact, hopefully remission, like it did in Hannah and in Ian Campbell and in Matt Bazzucchi, but some benefit to their psychiatric symptoms.
So you've mentioned ketones, you've mentioned keto. Can you explain what ketones are and what the ketogenic diet is?
Yeah. So let's reverse that and first start with the ketogenic diet. So ketogenic diet is essentially any diet that reduces your carbohydrates enough so your body switches from using glucose primarily for fuel to now using fatty acids for fuel. And this is one of the beautiful things. You hear this, I even hate to bring it up, but the U.S. News and World Report that the keto diet is the worst diet out there. But Mediterranean diet's fantastic, and vegetarian diet's fantastic. Well, guess what? You can have a Mediterranean keto diet. You can have a vegetarian keto diet. There is no one keto diet. So when someone says the keto diet is terrible, that just shows they don't know what they're talking about, basically, unfortunately. But any diet that lowers your carbohydrates enough and provides your fuel from fat and some protein, but usually, burning mostly fat for fuel, that's a keto diet. And it can take many different forms. Now, ketones, you say, well, if you're burning fat for fuel, didn't you say you burn ketones for fuel? Yes. So your muscles, your body, your organs, you're burning this fat for fuel, converting it to energy, which, by the way, is something we've done for centuries in evolution, right? Periods of famine or just periods, with hunter-gatherers not having a lot of food that they've gathered or whatever, they go into ketosis. It's a natural process. There's nothing harmful, nothing dangerous, completely natural. But when you're burning fat for fuel, a byproduct of that is ketones, and it's basically just a molecule in your body. You may have heard beta hydroxybutyrate or acetoacetate or acetone. Those are sort of the three most commonly talked about ketone bodies. Well, it turns out our brains can use that very efficiently as another fuel source, right? So our muscles and everything is burning fatty acids, but our brain is going to burn and utilize those ketones and convert them to useful energy. So that's what ketones are. They're the byproduct of using fat for energy. And a ketogenic diet is anything that allows us to switch from burning glucose to burning fatty acids. And in the process, we improve our metabolism dramatically because we're no longer dependent on glucose. We're no longer dependent on insulin. And we provide this alternative fuel source for our brains. Well, it's pretty amazing situation. And it is a true physiologic switch. So, if someone says, all you have to do is reduce your calories, 500 calories, and you'll be fine. You're going to improve your metabolism and you're going to lose weight. I mean, maybe some people may succeed with that, but that is a far cry from the intervention of ketosis, where you are actually changing your metabolism. They're completely different. So I don't even like to talk about it as a diet. I give a talk when I say, when is a diet not a diet? Is the topic, is the title of the talk. And this is it. I mean, ketosis, although you can get there, and most people do get there with a ketogenic diet, ketosis is not a diet. It's a physiologic state, and it completely changes your metabolism. And you can get there with multiple different diets.
So you bring up an interesting point. I think most people have heard of a ketogenic diet in terms of weight loss. Is this diet or food plan or way of eating as a mental health therapy different than how it's presented within the sort of billion-dollar weight loss industry?
Well, yes and no. So the basic constructs are very similar, right? You reduce your carbohydrates, you make sure you're getting an adequate amount of protein, and you fill in the rest with fat. So the basic construct is the same, but for weight loss, it's kind of really all you have to worry about. And you naturally reduce your calories because it's more filling and satiating, and you sort of naturally reduce your calories, your insulin levels drop, you improve your metabolism and lose weight. When it comes to a mental health intervention, then we get a little more specific because you want to make sure you're getting adequate levels of ketones. Now, the research is still happening, right? We're still learning what that means. But Dr. Ian Campbell presented some of his preliminary data from a research study he did in Edinburgh using a ketogenic intervention for patients with bipolar disorder. And what they found was symptom improvement tracked with ketones. So for weight loss, if your ketones are 0.5 or 0.8 or 1.5, doesn't matter. You're going to lose weight because you're in ketosis, you're reducing your calories, and you're reducing your insulin. But for mental health interventions, it appears you might want those ketones to be a little bit higher. So you might want to formulate the diet differently to give you higher ketone levels. And that's where working with a dietitian or a health coach or even a physician who's very knowledgeable with ketosis and ketogenic diets can be really beneficial.
So are you saying that it's all or nothing, that you either have to be in ketosis or not? Or are you saying that a reduction in carbohydrates that even brings about a small measure of ketosis can bring improvements in mood and stability?
I think it's likely a spectrum. I mean, I think if somebody gets into ketosis, they're going to see improvements. Now, if they sort of push that ketosis higher, are they going to see greater improvements? That's what Dr. Campbell's data seems to indicate. So as we get more data and more clinical experience, but the same is true sort of for epilepsy, right? The basis of ketosis as a medical intervention comes from the field of epilepsy, where it's been used for over 100 years and studied for the past few decades. And in kids, they try and push ketone levels higher, like to 2, 3, 4. They want higher ketone levels because they see greater seizure reduction. So will the same thing apply to mental health? I think there's a good chance it will, because the brain is the brain, right? The more ketones you provide the brain, sort of the more efficiently and the better it can work. Seems to make sense. We're still waiting for, scientific proof on that, but that's a lot of people do suggest pushing the ketones a little bit higher, but that's not to suggest you won't see any benefit at a lower ketone level. And look, even someone eating a standard American diet, getting off the ultra processed foods, getting off the super high carb refined grains, the high calorie combined fat carbs, foods, and just eating a healthier diet is likely going to give some improvement. Now, will it give as much of an improvement as if you flip that switch and get into ketosis? Probably not. But it still is a great first step for a lot of people. If someone's like, I don't want to try that ketosis thing, that doesn't sound right for me, just improving your diet to a whole food, natural food diet is going to bring huge improvements. Now, I would argue you could probably see even greater improvements with ketosis for most people, but it's all a spectrum, I think.
Well, I love that you brought up epilepsy and the use of keto as a treatment for epilepsy, because for those of us who are involved in mood disorders, bipolar disorder, we know that the primary pharmacological interventions for bipolar disorder are mood stabilizers, but that those mood stabilizers, nearly all of them, lamotrigine, oxcarbazepine, they are actually anti-seizure medications. And so clearly there's a connection between epilepsy and bipolar. Do we know what that connection is, or is that still being discovered?
Yeah, I mean, a lot of the mechanisms are still being discovered. Look, even the mechanisms for epilepsy are being discovered. But yes, you said that very well. The crossover in medications is significant which suggests the crossover in mechanisms is significant. We know from epilepsy, there's a component of hyperexcitability of the cells, probably has something to do with mental illness as well. We know that ketosis can regulate GABA and glutamate, increases GABA, decreases glutamate. GABA is more, you could say, relaxing to the neurons. Glutamate's more excitatory for the neurons. So being able to balance that better, ketosis can do that. Some medications can do that. Decreases neuroinflammation, improves mitochondrial function and energy production. All these things that can help in epilepsy can help in mental health disorders as well.
We have a question here from an audience member asking, what level do ketones have to be at in order to see improvement in mental health systems, and how do you test a ketone level? I think you already answered part of this by suggesting that any improvement in diet towards natural, more healthy foods is going to have some benefit. But
Right.
How do you test for ketones, and how far into ketosis do you need to be?
Yeah, so nutritional ketosis is generally defined as a beta hydroxybutyrate level of 0.5 millimoles per liter. That's sort of where ketosis starts. Again, that doesn't mean you won't see any benefits lower than that, but that's where it starts. And then in Dr. Campbell's study, going up to 2 seemed to be a sweet spot. Now that's blood testing. So that's doing a finger prick, just like if anybody's ever checked their glucose, you do a finger prick, you put it on a little stick and you put it in the machine, and it gives you your beta hydroxybutyrate level. That is the most accurate and the most well studied. There are also the urine strips, which are, to be honest, not that great. They can kind of tell you if you're in ketosis or not in ketosis, but not the level of specificity that the finger sticks can do. There's also the breath meter, which measures acetone rather than beta hydroxybutyrate. They are improving as the technology improves, but also not as specific and to the same level of detail as the finger stick. So I'm a big proponent of the finger sticks, especially if it makes a difference. If you're 1.5 or 0.5, you want the finger sticks. If all you care about is if you're in ketosis or out ketosis, then urine strip or breath analyzer is perfectly fine.
I would imagine from much of our audience, if they are interested in this for a child, that perhaps a finger stick would not be something that child would consent to on a daily basis. So it is good to know that there are other options, even if they are not ideal. I saw someone raised a hand. If you have a question, please put it into the Q&A or into the chat. That way we'll be able to see it and make sure your question is asked. There is another question here about overall gut health. I wonder, the question reads, I wonder what you think of probiotics to promote gut health for the treatment of depression and PTSD.
Yeah, so it's clear there is a gut-brain connection, absolutely. And so the better gut health, the better neurotransmitter production, right? A lot of our neurotransmitters are actually produced in our gut. You have to admit, I was pretty surprised when I read that. Like, I said, wait a second, neurotransmitters in our brain, but our gut's down here. It's like, it's all just part of this, body-brain connection. It's a real thing. So yes, taking care of your gut health is very important. Ketogenic diets can absolutely improve gut health as well, and your microbiome and neurotransmitter production. Prebiotics, probiotics, I think they all have a role. Exactly how big of a role? That's kind of hard to say, right? If you just take a probiotic and that's all you're doing, probably not going to get you where you want to go. If you're using it as an adjunct to other therapy, whether it be ketogenic therapy, other metabolic therapies, okay, then it makes more sense. There's, so many different testing companies now to test your microbiome and see where the science is definitely evolving. I'd say it's still very early. There are a lot of big proponents because there's, big money and companies supporting this, but I think we have to be careful about how strong of a connection we say just changing this one bacteria in your gut or taking this one probiotic, how strongly we say that's going to translate to benefits. But I think being mindful about your gut, about taking care of it, about eating prebiotic foods, about eating, fibrous foods. And if you can't tolerate those, then absolutely taking probiotics likely can impact, especially when you're combining it with other therapies.
Related to that, there's a question here about using supplements to induce ketosis. Is that something that you can tell us more about?
Yeah. So there are maybe a couple different ways. I mean, you can use MCT oil or coconut oil, which your liver can quickly convert to ketones. So that can raise ketone levels. Or now there's a big market of people marketing exogenous ketones. So an actual drink with ketones in it, with beta hydroxybutyrate in it. And you just drink it and you can measure that your ketone level goes up. Now, again, research is ongoing, but it really appears that it's not enough, that can get your ketones up temporarily, right? So one, you got to keep chugging the stuff and it can get pretty expensive. But two, it doesn't impact your metabolic health, right? So remember, as I was talking about ketosis, I mentioned how it improves metabolic health and you increase your ketones for your brain. Well, if you're drinking ketones, all you're doing is giving, ketones to your body. You're not doing the metabolic health standpoint. So I think it's important to do both. And if you do it so that your body is in ketosis, you're constantly producing ketones. It's not that you get a spike and a decline and then you take your next dose and die. You're constantly producing ketones. So I think there's something to be said for that. Now, if there are some people who on a ketogenic diet simply can't get their ketones above 0.7, 0.8, it's just their body's not wired that way. So if those people supplement with exogenous ketones or MCT oil to push their ketones up to 1.5 or 2, will they see greater impact? Maybe. I would love to see someone do that study. But it makes mechanistic sense. And some people have had some clinical experience with it. But interesting, if we go back to the epilepsy world, treating seizures with exogenous ketones doesn't seem to have the effect that the diet has. So there's definitely something more about the diet. So I like to think of the exogenous ketones as a way to maybe pump up the ketone level a little bit if that's something you're after, but not as the end-all be-all way to get into ketosis.
So there are a couple of other questions here that are related to one another. So I'm sort of going to pull them together. And they're really more about the pragmatic implementation of the diet, about how long it usually would take to see positive effects from the keto diet, and to see whether or not there are any modifications that could be made if you're having any struggles sticking with the diet. And again, our community has lots of parents whose children would be using this intervention. And so they may have sensory sensitivities to certain kinds of foods because those are often co-occurring. So how would you be able to do this in a way that might be modified? And how long would it take to tell whether or not you were getting benefits from it?
Yeah, great. All great questions. And, one thing that is really interesting about sort of the clinical experience and the case reports that we're seeing about improved mental health with ketosis is, we hear a story of someone who's had schizophrenia for decades. And within 2 days of starting a ketogenic diet, her hallucinations are gone and her paranoias are gone. And she's lived with them every day for decades and within 2 days. Then we hear other stories of clinicians who say, no, it's going to take 4 months before you really see improvement because your brain needs to heal. Your neurons need to heal. Your mitochondria need to heal and start producing energy better. That doesn't happen overnight. The metabolic shift happens quickly. The weight loss can happen quickly. The metabolic health benefits can happen very quickly. But a number of clinicians sort of caution about expecting an overnight improvement, especially when we see, case reports of people having overnight improvement. That seems to be the exception more than the rule. And improvements can start, but maximum improvement might be months away. In terms of modifications, look, remember what I said, any diet that gets you into ketosis works, no matter what it looks like. So whether it's, bacon wrapped steaks, which is what a lot of people think of, or whether it's avocado and nuts and broccoli, that works too. You need some protein source in there, but any diet that can get you there works. They make supplements or rather shakes, like meal replacement shakes now that are pretty good. I mean, they're meant to be a meal replacement and be in ketogenic ratios and keep your body into ketosis. And they can taste pretty good. So that's an option. So there are lots of different ways to modify just with different foods. The key is keeping the carbohydrates very low. So especially with kids, they might miss their pizza, they might miss their bread, they might miss their bagels, and they might miss their donuts. Look, there are keto versions of all of that. It takes time. You got to do the shopping, you got to do the cooking, and you got to prepare it. But there are absolutely keto versions of all of that. I was previously the medical director at dietdoctor.com. And I mean, the number of recipes on that website are enormous, but the most common are the keto bread, the keto pizza. It's a lot of the carb replacements, but they can do it. Yeah.
So I'm seeing a lot of questions coming up now, sort of wanting to hear about the safety issues associated with it, where I'm seeing again a bunch of questions that I'm going to sort of pull together. But they're asking about, are there any problematic impacts on the gut from this? Are there impacts on the kidneys? Should people be drinking extra water if they're on this diet? And let me just check to see if there's, those are the questions about safety right now. Like, will it have a ripple effect that might be negative onto other organs and other aspects of our physiology?
Yeah. So safety is my favorite topic. And I mean, look, I can give you the 2-second answer, which is it's safe. You don't have to worry about any of that. But my guess is people want to hear more. So let's talk about more. So, first, types of ketogenic diet. So when you're treating a 2-year-old with epilepsy with a ketogenic diet that you start in the hospital, you put them on what's called a 4-to-1 ketogenic diet, which means for every gram of protein and carbs together, you have 4 grams of fat. So it is a very high fat, very low protein diet. That is not a sustainable diet for the long term. And kids may have some growth deficits with that, but they catch up once they're transitioned off that diet. But that's not the diet we're talking about. We're talking about like a 20 to 25% protein diet with maybe 5% carbs and the rest fat. So it's going to be a very different diet, more of a real foods kind of diet. With that diet, there are really no concerns. There's absolutely no proof it hurts your kidneys. There's absolutely no proof there's any growth stunting. There's no proof that it hurts your bones. There's no proof that it gives you cardiovascular risk, which is one of my favorite topics. So I will talk more about that. The problem is there is an anti-keto bias in the medical community. Absolutely. There's an anti-keto bias in a lot of mainstream media. Absolutely. So they will hold on to any evidence that suggests keto is harmful. And the problem is you can see a study that uses 25% of your calories as carbohydrates, which is not even close to a ketogenic diet. And it gets reported in the media as a keto-like diet. And then that gets translated into this keto diet showed these problems. That's not a keto diet, not at all. So we have to be very careful about how we interpret news that's out there. Again, one of my main jobs at Diet Doctor was creating blog posts and videos, undoing a lot of this misconceptions and this misinformation, because unfortunately it is rampant. And the thought that it's going to hurt your bones. Well, yeah, if you're on a 4-to-1 keto diet for decades, your bones are going to be lacking in protein. And sure, but that's not what we're talking about, right? We're talking about a long-term keto diet, not this 4-to-1 intervention. So that's the other concept. If we try to extract data from 2-year-olds with epilepsy who are only on the diet for a year or two and try and say, what does that mean for a 15-year-old who's on the diet for 20 years? No, you can't do that because it's a completely different diet. So that's hopefully shows you that the problems with how many people interpret this, but there's absolutely no credible evidence that a keto diet is harmful in any way. Now, the one thing it can do is raise LDL, your LDL cholesterol. But again, the caveat is that is the exception, not the rule. The overwhelming majority of people who are on a ketogenic diet do not see a rise in their LDL. In fact, they see their cholesterol overall improve because HDL goes up, triglycerides go down, and then all their metabolic health parameters improve as well. There is a subset of people in which LDL will go up. So for now, it's something we have to take note of and be aware of. there are studies ongoing to say, is this really a harmful thing for someone who has very good metabolic health and is in ketosis? Because that is a unique situation that's never been studied before. All the studies that correlate elevated LDL with increased heart disease did not have any of these people in it. There are some signals that with good metabolic health, the negative impacts on LDL are dramatically reduced. So we need more information to figure that out. But that's really the one thing I think to be aware of, and follow with your physician. But I think physicians should understand that this is a unique physiologic subset that shouldn't necessarily be treated like everybody else. So that's my little soapbox. We have plenty of videos at Metabolic Mind, plenty of content at Diet Doctor that goes into more detail about all this. So I recommend people look that up if you have other concerns.
And when we post this this recording of the seminar on our YouTube page, we will include links back to Metabolic Mind and Diet Doctor and all of these resources that Dr. Scher is talking with us about today. So another set of questions that are coming through on a similar theme is, do you have a recommendation about what that ratio is supposed to be? Should it be, 10, this person has written, for instance, 10 total grams of carbs minus 3 grams of fiber equaling 7 net carbs. Are we doing that kind of counting on this kind of diet? And how do you, where's the other question? Are there recommendations onto certain types of foods or drinks that you would recommend avoiding other than the highly processed, highly sugared foods?
Yeah. So I think in the beginning, it can be very helpful to count carbs. I think long term, it is, a pain to do, and not everybody's going to want to do it. But I think once you get into the groove of understanding how you're doing things, and if you're testing ketones, you don't have to count all your carbs. But I think in the beginning, keeping your total carbs below 30 or your net carbs below 20 can be very helpful to keep track of that. Now, some people will be in ketosis at higher level of carbohydrates, but if you're below 30 per day, chances are just about everybody's going to be in ketosis. People who are more physically active and more metabolically healthy can be in ketosis at 50 grams, maybe even 70 grams of carbs. But under 30, pretty much everybody's going to be in ketosis. And from there, once you've established that pattern, then if you want to add more carbs, you can, and keep testing your finger sticks and your ketone levels to make sure you're still in ketosis. Now, adding carbs does not mean go out and have a donut, does not mean go have a big bowl of cereal or a big bowl of pasta. The carbs I would recommend adding are more vegetables, more fruit, more nuts, right? More the whole food, natural food carbs. And so, yeah, that's what I would definitely recommend. And in terms of foods to avoid, I mean, I sort of alluded to it there. Any grain, any sugar should be absolutely avoided on a ketogenic diet. So if you want to add carbs, those are not the ones to add for sure.
So you talked a lot about sort of the cardiovascular implications of this diet. I know there's some people in our community who are concerned about co-occurring disorders, for example, with diabetes. We've all heard about ketones being problematic in diabetes, especially type 1 diabetes.
Yeah.
So I'm wondering if you can speak to what we would do for someone who might have a family history of diabetes and might be very concerned about that in relation to this diet.
Yeah, so I think one of the worst things we ever did was call type 1 and type 2 diabetes by the same name of diabetes, because they are completely different. So I think medicine needs to separate those. The other thing, though, is it's a great question, because even as doctors, really the only thing we learn about ketones is the danger of them, of ketoacidosis. So ketoacidosis is what happens with individuals with type 1 diabetes who have essentially zero insulin production. Their blood sugar gets super high, but their body can't access any of it. So they go into ketosis because they don't have insulin. You need insulin to access the blood sugar. They go into ketosis because they're essentially starving. Their cells are starving. And because their blood sugar is so high, they're in this spiral. So their blood gets acidotic. Their ketone levels get up to 10. Remember, I was saying before, 0.5 is nutritional ketosis, 2, 3, 4 is sort of like good targets. In ketoacidosis, you get up to 10 and your blood turns acidotic, and it is a life-threatening condition. But that is nothing to do with nutritional ketosis, right? Now, so that's all we're really taught. So that's where we get this conception that ketones are dangerous. And yes, in that setting they are, but not in nutritional ketosis, which, like I said, through evolution, it's pretty, we never know exactly what happened in evolution, but it's pretty clear that we were in and out of ketosis all throughout evolution with ketones in our bloodstream. The other thing with type 2 diabetes, though, with type 2 diabetes, not type 1, is that you generally have some insulin production, but you can get to the point where you get sort of quote unquote burnt out pancreas and need to take insulin. So same sort of thing though, as long as you have enough insulin, you're not going to go into ketoacidosis. But if you have a complete absence of insulin, you could. Now, the concurrence of type 2 diabetes is a good thing in a way, because the ketogenic diet is the best dietary intervention for type 2 diabetes. There are lots of different ways to treat it, but from a dietary standpoint, the most effective is ketosis. You reduce the carbohydrates, you're lowering your insulin levels to the point where now your body can respond better to insulin. You're improving your insulin resistance, which is the pathophysiology of type 2 diabetes, and that's how you can put type 2 diabetes into remission. When I was training as a doctor, I never heard the term type 2 diabetes remission. Nobody was even talking about it. It wasn't until people started studying ketogenic diets as an intervention for type 2 diabetes that now we have this term, remission of type 2 diabetes, because it's completely possible. Before, it was just manage type 2 diabetes with medications to keep blood sugar in check, but do nothing for the underlying cause. Well, ketogenic diets completely put the underlying cause into remission.
I've seen you talk a little bit about sugar substitutes, and we have a question here about sugar substitutes. I think when anybody thinks about a diet, they think about switching to Splenda or NutraSweet or something along those lines, or some of the new monk fruit derived natural sugars. Can you talk a little bit about how those may or may not be appropriate to use on a keto diet?
Yeah, I think in a perfect world, nobody would need any of them and nobody would ever use any of them. But we don't live in a perfect world, right? We live in a world where we are accustomed to sweet foods. One of the beauties about a ketogenic diet is when you've been on it for a while, your taste buds change. And all of a sudden, a blueberry, which didn't seem that sweet before because you needed the chocolate and the candy and that was sweet, your taste buds change. And now all of a sudden the blueberry, that's pretty sweet. A strawberry, that's pretty sweet. Your taste buds change in that way. For those people, though, who really like a treat, who it's going to help them, then some of these, sugar substitutes, whether it's monk fruit, whether it's erythritol, they can be really helpful because they don't affect your blood sugar and your insulin. And so your body doesn't necessarily recognize it as sugar. Your brain can still, because you get that sweet taste. So here's the sort of slippery slope. There's some people who can have a little bit of it and be perfectly fine with it. And it sort of, scratches their sweet tooth or however you want to say it, and they can move on. There are some people who that's going to trigger, ooh, that's sweet. I want more. And you're just going to want to have more and more and more of it because that sweet hits your dopamine sensors, right? It hits your pleasure sensors and you have that addictive personality or that addictive connection to sugar. There's a number of people who have that, and this sugar substitutes can trigger that. So the only way to know really is just to try it and see how you can do. Can you moderate it? Can you not moderate it? But that's why I say in a perfect world, nobody would need them. And over time, your quote unquote need for it is going to decrease in ketosis because your taste buds do change.
So how safe is this to do with children? Because, we have a lot of folks in our community, as I say over and over again, who are parents, but they think oftentimes in terms of how is my child going to be able to do this, not just from a safety, from a physiological standpoint, but how are they going to do this at school? How are they going to do this when they go to a birthday party? How are we not going to turn our family celebrations into something incredibly boring because now we can't have a birthday cake? How do you respond to that?
Well, first, let me so yes, great questions. Absolutely. So I had a relatively big birthday recently, and my family surprised me with a birthday cake, which was wonderful. It was a keto cheesecake birthday cake, and it was delicious. So they exist. You can do it. Now, look, we do not live in a society and a world that is friendly to this. That is just plain and simple. Your kids' friends are going to be eating pizza, eating cake. They're going to be bringing, even I remember as a kid, Little Debbie's. I always brought the Little Debbie's in my lunch every day, right? I'm sure kids are bringing the equivalent to school. And there's no question for kids, it is a challenge. And just think about, people with type 1 diabetes, right? Kids with type 1 diabetes face the same problem. They can just cover it with more insulin, which is kind of a crime. I think about to say that's the right way to do things. But if you're using ketosis to treat your mental health disorder, you can't just cover it with something else. So there's no question it's a challenge. It comes down to education. It comes down to helping your kids see the alternatives. I wish kids were more accepting. So if your kid just told their friends, oh, I can't eat that because of my bipolar disorder, a lot of kids aren't going to be very accepting of that. So I feel for parents. I feel for kids. I know it is challenging, but I think it's more challenging to be in and out of, a mental hospital because a kid had a psychotic break or a manic episode, that's more challenging. So you sort of have to pick and choose. And, dealing with older teenagers or young adults, when they say, goodness, I will never eat a pizza again because I know what it feels like to go down that path. And if I'm a little ostracized in certain groups, that's okay because I have my mental health. That's a lot harder for an 8-year-old, a 10-year-old, a 12-year-old. So, I wish I had a really easy answer other than to say you look for substitutes, right? You send your kid to the birthday party having already eaten, so they're not hungry. And maybe you send them with a fat bomb candy to lunch, right? So it looks like they're eating a quote unquote treat or something, but it's a fat bomb with a little cacao, with maybe a little monk fruit, and they sort of can fit in that way. So there are tricks like that, and this is where it's really helpful to work with a very experienced dietitian who will know all the tricks and have all the recipes. And again, I can point to websites like dietdoctor.com that has a lot of these, but sometimes really working with somebody one-on-one who's been there can be helpful. But yeah, it can definitely be a challenge in that age group.
So we have another question here saying, would it be possible to comment on a common misconception regarding systemic serotonin? Serotonin produced in the gut does not cross the blood-brain barrier, and for this reason may not directly improve depression. It certainly affects the functioning of the body, and a person may feel better for that reason, but it's not changing levels in the brain, which are thought to cause depression. And the person included a link to an article from NIH.
Yeah.
Wondering, you want to respond to that?
Not really.
Okay. All right.
That's definitely outside of my realm. Look, one of the interesting things about my role is I'm not a psychiatrist, right? I'm a cardiologist, but I'm a cardiologist who focused on metabolic health for over a decade. I'm a metabolic health specialist, and I'm a ketogenic therapy expert. And now I'm using that to translate to mental health. Now, whether gut serotonin improves mental health, to me, that's not something I feel comfortable commenting on, but I know changing the fuel in your brain does, right? Changing the fuel with ketosis does. That's part of the theory of why gut health can improve because of neurotransmitters. But beyond that, I don't feel comfortable commenting further.
That makes perfect sense. I think one of the things that's so fascinating about this approach to treating mental health is that there are real gatekeepers in psychiatry, that psychiatrists tend, in my experience, to move at a rather slow speed when it comes to adopting new approaches. And yet this feels like something that people can be empowered to do at home for themselves, for their families, without having to get a psychiatrist involved, having a PCP involved who understands keto and can advise them. It is often sufficient. Is that correct?
Yeah, one of the biggest challenges we have at Metabolic Mind is so many people find our content and say, I can't find a psychiatrist to treat me with this. What do I do? And that's true. We need to train more psychiatrists. Absolutely. We need to make more psychiatrists aware of this. But you are absolutely right. If you have a dietitian who can help you and who can communicate with your psychiatrist, who speaks the same language as your psychiatrist, who can, help them understand what's happening, then the psychiatrist doesn't have to give you the ketogenic intervention. The dietitian can, in conjunction with the psychiatrist. The psychiatrist definitely still has to be involved. A health coach can do the same thing. And if a primary care doctor is doing it, even better, because they're more likely to have that direct line of communication to your psychiatrist. So the psychiatrist needs to be involved because, look, things can happen. There is a sort of a 2-week induction period that a lot of people go through when you go into ketosis, where there have been reports of people with bipolar disorder getting hypomanic, people with major depression getting worse during that initial 2-week period, often called the keto flu, sleep patterns changing. So your psychiatrist needs to be on board and monitoring for those things, but generally it can be run by a keto health coach, a dietitian, a primary care physician with communication with a psychiatrist. So it doesn't have to be all from the psychiatrist, but they still have to be involved.
So there's a question here that's related to that, which is that are we talking about keto instead of treatment or as a supplement to augment treatment options?
Yeah, definitely as a supplement to augment treatment options is generally the best way to start. Now, we have a video, again, at Metabolic Mind on our YouTube channel about tapering medications with nutritional ketosis. And I highly recommend it because Dr. Georgia Ede does a fabulous job of explaining the way she approaches this, which I think is so important for people to understand. And Matt Bazuki shared in this video, he shared his experience of how he tapered. And it's slow and measured and careful. So it can be done, but by no means does it even have to be done. And what Dr. Ede says is a number of her patients start a keto diet and they feel better. They feel great. They don't want to change anything. They don't want to taper their medications. They're perfectly fine continuing with their medications. But then you talk to someone like Matt, who is having so many side effects from his medications, that the ability to slowly and safely taper his medications help him get his life back. So I would absolutely not say, just start a keto diet, stop all your medications, make it the only therapy. Absolutely not. Use it as an adjunctive therapy and then work with your provider to see if you want to or can safely change some of your medications. But first and foremost, it's an adjunctive therapy.
I do appreciate hearing you say that, because one of the things that we always talk about at Children's Mental Health Resource Center is that treatment, it doesn't have only one side to it. I always talk about treatment as being like a 3-legged stool. You need all of the pieces in order for it to not fall over. And those pieces are the psychiatrist and the monitoring with the psychiatry piece, having a therapist or a life coach or someone who is there to listen and to help you process and make choices. And then there are the lifestyle interventions, of which there are many that can be used adjunctively, can be used as supplementation to enhance all of those pieces of the treatment plan.
I think that's right. Well said.
Yeah. So we're coming sort of towards the end of our time together. And so I'm wondering, what have I not asked that I should have? What information do you want to make sure we get out to people in our remaining minutes?
Yeah, I mean, I think the most important information is that people are looking for help now. Do we have the 10,000 person randomized controlled trial for 5 years showing now? But no, we don't have that. We have pilot studies that are being presented and being done showing safety and efficacy. A number of, clinical practices that do this, hundreds of anecdotes of people sharing their stories. So people who are looking for help now, I think it is absolutely something to consider. But doing it right and doing it with professional guidance is so important right now. I hope we can get to the point where we can just say, here's this app go for it. It'll do everything for you. You don't need anything else to make it that easy for people. I hope we get to that point. I don't think we're there right now, unfortunately. So I think it is important to do it with professional guidance. You can find people who have been trained, clinicians who've been trained for this at diagnosisdiet.com/directory. It's Dr. Georgia Ead's site, and she has a directory on there. I think that's a really important place to start. And I just want to reemphasize sort of the safety of things. Now, there are labs you probably should be following. We have a whole video on labs to check and labs to follow. So I guess that's the other thing to mention is our resources at Metabolic Mind, either at our website, metabolicmind.org, or our YouTube channel, which is where most of our content is, which is Metabolic Mind at YouTube. So those are great resources for people who want to learn more. So I strongly encourage people to check that out.
It sounds to me as though it would also probably be of great benefit to people to be able to get support from other people who are trying to do this same intervention at the same time, and being able to get support and encouragement and determination and stick-to-itiveness from that community. Have you done that? Have you been experimenting with that?
Yeah, it's something we constantly talk about. Metabolic Mind, we started as 2 people. Now we're 4 people, soon to become 5 people. So as we're growing our team, we want to take on more and more activities. And I think a community support would be tremendously helpful.
Yeah. Okay. Well, I'm just going to peruse our questions one last time before. There are a lot of questions here about who to seek out in order to try to start doing this diet. And so again, we're going to take all of these resources that Dr. Scher has shared with us, and we're going to put them with the recording of this event on our YouTube channel. So you will be able to find links to all of these resources there and be able to get started on your own timeline.
Yeah.
So I want to thank you so much for being here with us today. This is something that I feel is really empowering for our community to know about, and I'm grateful that you took the time to speak with us. So thank you so much.
Yeah, my pleasure. Thank you for having me on. It's such an important topic that I love the opportunity to share it so people can learn about it. Because again, like I said, doctors aren't being taught this. Therapists aren't being taught this. Even dietitians aren't being taught this. So we need to change that, and we change it with programs like this and what you're doing to help just spread the wisdom. So thank you.
Well, thank you. And for those of you who regularly attend our webinars and seminars, if you would like a certificate of participation or a certificate of completion, please email us at admin at cmhrc.org. Let us know if you're a family member or a professional. We have different certificates depending, and we will make sure that those get out to you. If you have additional questions that you didn't get answered here today, please feel free to also send those to admin at cmhrc.org. We will be in conversation with Dr. Scher, and we will get your questions answered and that information back to you as soon as we can. So thank you again for being with us, Dr. Scher. Thank you, everyone, for being with us and listening to this fantastic conversation. And have a wonderful rest of your day. We'll see you next month. Thanks, everyone. Bye now.